and thank you for joining us for the 2024 North Carolina Medical Society Candidate Series. Today I'm joined by Dr. Greg Murphy, who is running for re-election to the North Carolina Congressional District Number 3. Thanks for being with us today.
Thank you so much for having me.
So I want to kick this off with, you've been in politics for a few years now.
Yeah.
Let's talk about why you've decided to run for re-election again, and give us an overview of your candidacy.
You know, I didn't go into politics on purpose. I kind of got pulled into by the Medical Society several years ago. We didn't have a member in the House who was a physician, and I kind of took on the guilt project. And I think when I came to Raleigh, we did a lot of good work in the opioid space. Since I've been in Congress, there are very few members of Congress. I'm actually the only one as a physician who still practices. And I think it's important that we have a voice for medicine. You know, when I talk to my colleagues, both across the aisle and in the aisle, a lot of folks know their topics very, very well. Well, I know medicine very, very well. And I think to be an advocate for those physicians who are out there in the trenches every day, working, taking care of patients, curing patients, I think it's important that they have an advocate in D.C. as a member of Congress.
I think it's great that you said that you are still a practicing physician.
Yeah.
That opens up this next question, because you were working here in North Carolina. And you know this already. We have a very large rural population here in the Greenville area, so you know this as well.
Yeah.
Legislatively, what do you think we can do about that to close that gap?
There are a lot of things that need to be done. We also have, let's just start from the beginning, the medical students coming in. Are we selecting the right medical students who are going to stay in medical school? And most importantly, when they graduate, are they going to practice? We have 63% of students now in medical school that say they're not going to practice clinically. So I put that back and say, hey, to the medical schools, where's your admission process? Where are you getting these folks, and why are they not staying in medicine? The other things that are for the physicians who are actually in the practice themselves that are just burning them out are prior authorization, the cut in fees that Medicare is now doing every year, the overburdening of regulations from all the different regulatory agencies in Washington and in the state for that matter. It's just a maelstrom of chaos that's wreaking upon the private practice physician and other employed physicians, where folks are not practicing into their 60s, mid-60s, or even 70s. They're kind of kicking the can down the road. We cannot let experienced doctors leave, and we got to let the people coming out of medical school, they've got to stay in practice.
You brought up something that is an issue our members have talked about, and that's Medicare. Mm-hmm. And across the state, there's an elderly population who's also worried about the future of Medicare. Let's get your thoughts on that, both for your constituents and as a practicing physician.
And I could, being on Ways and Means, I'm on that committee which covers Medicare. I could speak of that for an hour. We had 10,000 individuals who come to the Medicare rolls every day. And in 1965, there were 4.6 people paying in for each recipient. That number's gone down to 2.5. So we have more individuals with fewer people paying for it, which puts the whole program at risk, meaning Medicare is going to have to be reformed, not replaced, not taken away, but reformed. We also know that people are living longer. But it costs medicine for us to live longer. We can't, with this growing population of Medicare, cannot keep facing the cuts upon the cuts upon the cuts to the doctors who are nice enough, really, humble enough to take Medicare patients in when they know that they don't pay for the bills.
We are actually filming this on March 27th. 1 year ago today, the governor signed the Medicaid expansion bill into law. So I want you to kind of reflect on that, how that happened, and what you think maybe are the next steps for the state of North Carolina.
Well, in 2016, Donnie Lambeth and I and a couple others put the bill Carolina Cares into action. And that was to expand Medicaid with a lot of, safeguards to it, that we were going to get paid, that 10% was going to get paid somehow. Took a little while, but the Medicaid expansion passed. Some of the caveats, though, just because you have coverage does not mean you have health care. It does not. And Medicaid pays even less than Medicare. And so paying the doctors to actually see the Medicaid patients is one. But then when you have such a shortage of doctors, and they're already getting overrun with Medicare patients, what do we do with the Medicaid patients now that, quote, have coverage? They don't have insurance. It's not health care, but they have coverage. It's a real challenging time. We need to keep doctors in the state who practice here, and we need to be able to recruit others to come to North Carolina.
You have been in office for a few years now. We were talking about this off camera. Let's talk about some things that you are particularly proud of in the past few years.
Well, I think I've tried to be as much of a champion for physicians as possible, working on prior authorization, working on the No Surprises Act, which we had a great bill, bipartisan, bicameral bill signed by the president, and now misinterpreted by the present administration's HHS. We've been fighting hard against that because it's left doctors and patients and hospitals alone and giving all the power to the middlemen, the insurance companies. Also, this past year, fighting fervently against yet another cut in Medicare. And sadly enough, it looks like physician payment is now becoming partisan, which I just don't understand. But I'm in Congress not for me. I love being a doctor, and I'm going to, as long as I'm there, try to focus on the things that my colleagues need to be effective and caring physicians in the future.
So before we go, I know there's no crystal ball, but looking forward, there are a lot of things on the healthcare horizon, things like AI, the opioid crisis. You mentioned that earlier, is still a big deal here in the state of Carolina. Just looking forward, what do you think some of the healthcare headlines are going to be, and what are your next hurdles you want to cross?
Well, until we get the control of opioids coming into the country, until we treat those who have an opioid addiction, I fear this is going to continue to get worse. We lost 110,000 individuals last year. I think it will continue to rise. Until we stop those two things, we're not going to make any progress. Artificial intelligence, actually, I'm leaving in a couple days for an overseas committee on conference on artificial intelligence. It can be literally, the making of the wheel. The whole concept of human in the loop, I really don't like that specific. We should be holding the loop. There's so many things that can go into artificial intelligence. When you pass away and I pass away, our collective knowledge goes with us. But with artificial intelligence, that won't. It will keep it there. I think being able to predict future drugs and molecules to affect disease is going to be a game changer. But I also think assisting doctors in the care, diagnosis, and treatment of patients will definitely improve.
AI is one of those mysteries to me. It's like, there's scary much of it.
It's scary.
I think it can be scary.
Yeah.
And the other side, I think, and maybe this is the path forward.
Yeah, it is, but you got to be careful about what gets put into it. Does it have biases? Does it have this? Does it have that? Is it trying to push the end recipient in a specific direction? Because that's a real something some people really should be afraid of.
And we're all learning about that together.
Absolutely.
So if people are interested in finding out more about you, how can they find that out?
Our congressional website is murphy.house.gov. My specific campaign website is murphyforcongress.com.
And we'll have all that information on our website. Thank you very much for talking with us today. Taking some time driving up here.
Appreciate it.
Through a terrible rainstorm for this. I appreciate it. All right. Of course, we have all of our other candidate members who are running on our website right now, and a few more still to check out. We'll have all those coming at ncmeds.org. We'll have all that for you and more. Make sure you check that out. Thank you.